afternoon.
Good afternoon.
Thank you so much for coming. Thanks for all of our partners in the community for being here today. Thank you to my colleagues from AstraZeneca. And thank you to all of our panelists for being here to be part of the conversation. And thanks to my colleague on the AstraZeneca HealthCare Foundation board, Dr. Tim Gardner. Dr. Gardner is a cardiac surgeon. He's served and practiced at Penn and Hopkins and is now the medical director for the Center for Cardiovascular Health at Christiana Care in Wilmington, Delaware. He brings deep clinical and practical experience to our board, and very, very grateful to Dr. Gardner for being here with us here today. What we're going to be talking about today are innovative approaches to improving cardiovascular health in our communities, and our conversation today will feature two of our grantees, our Mid Valley Family YMCA and the Westminster Free Clinic, both of whom are receiving grants from the AstraZeneca HealthCare Foundation and our Connections for Cardiovascular Health. I think Dr. Gardner would agree with me that probably the best day of the year are the days like this, where we actually get to come out in the field and be with the folks that have received these grants and meet some of the people that have benefited from these programs in real life. I think one of the hardest days that we have in the year is the day in late fall when the board comes together and reviews the hundreds of grant applications that we get each year. So many communities in need, so many innovative approaches, so many organizations that take the time to put together these grant requests, all in the service of their friends and neighbors and their communities. And among those hundreds of applications this year, we selected 11. And many of those 11 are in their second or even third year of receiving grants. And so the folks at their table here today, these two organizations serving this community, are truly, in our estimation, among the best of the best doing what they do in the entire country. The American Heart Association sadly estimates there are about 85 million Americans that are afflicted with some form of cardiovascular disease in our country today, and remains a leading cause of death. A startling number, alarming number, a number that none of us find acceptable, which is why at our foundation we were really committed to giving out these kinds of grants. And our approach is to find innovative programs that are being run at the grassroots level. We didn't want to build a whole new program, but rather to go out to find programs that are happening organically out in their communities, high touch, innovative programs, particularly in those communities that are especially in need of additional help. To date, since 2009, since this program's been running, we've had about 51,000 people come through the various programs all across the country. And importantly, one of the things that we really prioritize is that these programs measure and show real change and real impact and outcomes year on year, and we have great evidence that these programs, these 51,000 people that have come through it, have indeed benefited greatly through different approaches to wellness, nutrition, diet, and exercise. We're seeing real change. So above and beyond what these folks are doing every single day, we thought, how could we even ask them to do more and help even amplify the messages that they're sharing here in this community with maybe some of those other applicants that are coming through every year and other programs that are not a part of our program. And that's to be part of a program like today, to share some of their best practices, to share some of their insights, to help tell us like what works and what doesn't work. We're videotaping these and we're going to splice them together. We'll put them on YouTube, but we'll also have all of our grant applications that come through year on year, commend for them to come back and listen to these programs to see what the best are doing and how they might emulate those practices. I'm very grateful to Juan de la Cruz from the Greater Metropolitan LA YMCA, who will be our moderator today and will take us through the conversation. And then a little bit later we'll get to the good part with the exchanging of the checks and the proclamations, but we thought we'd at least begin with a thoughtful conversation. So Juan, please join me. Thank you.
Thank you, Rich, and good afternoon, everyone. Thank you for being here. I am the moderator. I'm the Vice President of Community Development for YMCA Metropolitan Los Angeles, so we represent about 26 Ys within Metro LA. And I'm honored to be here, and first of all, thank you to our trustee Dr. Tim Gardner for being here as well and being part of this panel. And I'm very honored to be here and be the moderator for this very important issue, which affects a lot of our Latino communities and throughout our state. And we're going to jump in straight to the data. According to the California Department of Public Health, cardiovascular disease, including heart disease and stroke, is the leading cause of death among Latinos in the state, accounting for 22% of all deaths. More than 10 have been diagnosed with diabetes, and 37% of low-income California Latinos rate their overall health status as fair or poor. These alarming statistics are coupled with a lack of access, professional facilities, and culturally sensitive programs, amplifying the health disparities and challenges to the communities that all these issues face. But the two programs we're highlighting today are looking at changing this. The first one is Westminster Free Clinic, Corazones Sanos, a Healthy Hearts program. And this program improves the health of low-income, uninsured Latinos who are at high risk or heart disease and or diabetes through culturally competent, patient-centered services, including early detection, through outreach and health screenings, access to preventative care and medical specialists, healthy lifestyle support, such as cooking, demonstration, and physical activity, and empowering through improvement and eating, exercising environments. Joining us today is from Westminster Free Clinic, are Lisa Safanilli, Executive Director, S.B. Gonzalez, Case Manager, and Carla Toledo, High School student and leader for the Corazones Sanos program. So thank you for being here. Our second nonprofit organization that's working with this issue is our very own Mid Valley. We have so many, it's hard for me to keep track. Mid Valley, yeah, I know, sorry. Mid Valley Family YMCA. The Y's active, Actívate Your Heart is Active Su Corazón. Active Su Corazón reduces the risk of hypertension and cardiovascular disease for underserved low-income adults in San Fernando Valley and helps them build sustain habits for healthy lifestyles. The free 8-week program uses education based on American Heart Association's Empowered to Serve curriculum, cooking demonstrations, grocery store tours, and group exercise and screenings. Joining us from the YMCA are Chad Mender, Executive Director, and Joni Novasaw, Community Service Director for Dignity Health Northridge Hospital Medical Center, Center of Healthier Communities, and instrumental partner in the development of the WISE program. And we also want to acknowledge some of our special guests here today. Our very own CEO and President of the YMCA of Metro LA, Alan Hostrup, our EVP and COO of YMCA Metropolitan Los Angeles, Mark Dangler, Sue Marasco, our Senior Vice President, YMCA, and then also retired LAPD Captain Greg Meyer, Board Chair of the Mid Valley Family YMCA, and also Brian Hamill, President of Dignity Health Northridge Hospital Foundation. So give them a round of applause, please. And this also couldn't be possible with the support of some of our elected officials. So there are some elected official representatives here, and so I would like to acknowledge them as well. Barry Worth Gervin on behalf of State Senator Bob Hertzberg, 18th District of California. Linda Leviton on behalf of Councilwoman Nuri Martinez, 6th District. Nancy Foley on behalf of State Assemblywoman Jackie Irvin, 44th District. Sherilyn Gutierrez, Westminster Clinic Manager on behalf of Ventura County Supervisor, and also Gabriela Marquez, District Director for Congressman Tony Cardenas, California, 29th District. So we're gonna just jump into it. We do have time limits, and Veronica's already told me. She's gonna pull my hair if I don't stay within that. But the joke's on her, I don't have hair, so we're gonna go ahead and try to stay on time and on pace. So the first question, we've noted some of the alarming statistics related to cardiovascular disease in our state. With this in mind, what are the biggest challenges your community faces with cardiovascular disease? And this is more geared towards our nonprofit, so anyone can go ahead and start the conversation.
Well, I'd like to also thank the AstraZeneca Foundation for your support of Westminster Free Clinic. We're very, very grateful, and we've had a great year. And I'd like to thank my team, who's all here in full force, Judy and Belen and Alicia and Claudia and Martha and Charlene. For us, the socioeconomic and environmental factors that we actually have control of that aren't genetic, that we really face, that we faced this last year with our families, is the fact that most of our people are very, very low income. So if the programs aren't free, they're not able to participate because they are having trouble even keeping a phone every month because their hours change. Another big factor for challenge for our population is that many of them are marginally housed. So there's a 2-bedroom apartment and you have 2 families, each one living in a different room in that apartment. So access to cooking and refrigeration and all of that is a big challenge for our families. Another is transportation. For our families, getting to the clinic, they have to pay someone to give them a ride usually. So that's really tough. So our whole focus is about being a one-stop shop, so they don't have to pay for rides too often to come and get services. Another problem for our population is limited education. Many of them were pulled out of school at a very young age, so they have a second grade or 4th grade education in Spanish. So literacy is a big challenge, and so for all of the things that we provide, having them be very visual and interactive and not a lot of words is really, really crucial. So those are some of the challenges that our families face. And the final one I'd mention just right now is the markets where they shop, often the Latino markets, they make their most money off of fried foods and unhealthy foods. And so convincing them to offer heart-healthy foods is a challenge, but really necessary for our families to even follow through when we teach them good things. If we're setting them up to fail, if they go back to their community and they can't actually buy those things.
Just also want to thank the AstraZeneca HealthCare Foundation. This is new to us, and we're very excited about our program. And just to kind of add to Lisa's comments, I think what both of these programs really do is we're really bringing down and eliminating all the barriers that prevent people from leading a healthier and active lifestyle. So by bringing together community partners and access to resources, we can really make a quick impact and a long-term plan for sustained health. As simple as the metric of providing childcare while the program happens. We are in the business of helping the entire family and teaching the entire family how we can allow them to sustain long-term health.
Dr. Gardner, would you like to add?
Well, I think congratulations to both of these programs, and I think the point that Chad just made, and obviously it's already in the name of the Westminster program, these are family programs, and concentrating on or focusing on getting the whole family attuned to healthier behavior is really a key thing. I mean, we're almost dealing with some cultural issues and cultural challenges. I congratulate you both for focusing on engagement of the family. And just to comment on the strategy, or one of the strategies you've taken at Westminster, which is to have teens engaged. I mean, that's really an innovative approach that we've seen work in other programs that we've funded. Teens who are concerned about their families, teens who are still free of cardiovascular disease, they're still sort of healthy and unaffected in most cases, and that's a really important strategy. And to get kids involved and teens motivated and teens involved in the education of their families is really a very good approach.
Rich?
Well, I appreciate the comments about relearning how to eat and what the food choices are, and especially we're in Mississippi yesterday and having a conversation about sometimes you're working against Southern cooking, right? And someone was saying that the origins of Southern cooking was if you were poor and had a limited amount of protein, how could you get the most calories out of that protein? Well, you covered it in flour, you fried it, and over time, you learn that it tastes good. But now, as one woman said, we were agricultural, we worked like farmers and ate like farmers. but we don't work like farmers anymore. So now it's gone the other way. We have an imbalance in the way we eat versus the amount of energy we actually use. And so they begin to train kids in this one community center that actually the green beans taste good just like they are. They don't have to be boiled down with bacon to taste. They'll taste good, but they don't necessarily, they could be eaten fresh and be better for you. So it is hard because you're working against sometimes culture and how you eat and what you eat, but you need to begin with, this is a tomato. It tastes okay with, without being fried and other things, and that's really hard.
Joni, would you like to
Yeah, I would definitely agree with the issues with Westminster as well. Is, in our area, a lot of our families are earning less than $40,000 a year income, and a lot of times they're making food choices based on budgets. And unfortunately, sometimes those frozen processed foods are so much cheaper, and so they're not looking at, through grocery store tours and health education and food demonstrations using cultural recipes with the right ingredients and switching things out so that you're not changing their culture, but you're helping them to make better choices on limited dollars is vital, because they just don't know that. And so their sodium intake is off the charts, whereas if they would cook it at home, that sodium could be a lot less.
Anyone else from Carla or Esperanza? Would you like to add?
I would just mention that growing up in a Latino household, I remember my father going to the doctor, and he would come back and I would ask him, what did they tell you? Nothing. They just told me to take medication. So I think that the health education portion of that is also something that our Latinos sometimes lack, understanding their health and what does it mean that I'm taking medication for cholesterol or for blood pressure. And at Westminster Free Clinic, that's something that we're working towards, educating in their own health, their health literacy.
So and let me get in there as the doctor on the panel. And we don't do, many of us don't do a very good job. We're see patients, individuals in our offices. The time is short. The ability to really relate and connect with the patients may be difficult. And we don't give oftentimes the full support and advice and education that people need. Oftentimes we're not even equipped culturally to do that, or linguistically sometimes. So that's why these community programs are so important. We can't do it. We're part of the solution in a sense. We have the science and the access to medication and so on and so forth, but it really takes a community to keep itself healthy. And these kinds of programs that are based in the family and are supported by the community are so important for those very things that you mentioned.
Thank you. And coming from a Mexican background, we love ourselves some fried food sometimes, and I blame the extra handles on my mom from the past. So moving on to the next question. What gaps or unmet needs do you hope to address through your program? And we can start with Chad. Go ahead.
Oh, okay. In our area, it's the unmet needs is, as Rich was saying, it's the leading cause of death, but in our area, it's also the leading cause of premature death. And that's followed by homicide, suicide, motor vehicle accidents. So the next three are not health related. So our area, the filling that gap is that education that health educators can bring, that are culturally and linguistically appropriate, that look like the community they're serving. It's the exercise classes. Most people can't afford gym memberships, that some of us can. So having the YMCA offering these free programs and then offering follow-up scholarships so that it becomes a habit, and then it becomes a priority. So maybe they have limited resources, but they now know how to utilize those limited resources to have healthier lives. And so in our area, we want to do the grocery store tours in the grocery stores where they live, and reaching them where they live, they work, they pray, they play, they learn. Taking it outside the walls of a hospital, being here at the YMCA, doing one of our interventions at a church, at an apartment complex of low-income people, taking the services to them so that it can be sustainable. So we're doing the education, but we're leaving them with knowledge that they can share with their friends and colleagues, because one of the things we know about this culture is they're very, very social. And believe me, they'll tell a friend and they'll tell a friend, like the old Breck commercials. So that's the gap we're hoping to fill.
One part of the gap that we're hoping to fill is getting the teenagers involved in their community and helping their community actually be healthy, and inspiring their local markets to make good choices. And when they're purchasing food to sell to their customers, we have found that teenagers are much more influential than we adults. Because our patients, as our participants, as well as the markets, love young people, and they want them to feel like they can contribute to their community, and they want to support their ideas. So engaging our teenagers from our actual client population is part of our solution. Another is to make it a holistic, supportive environment where when someone comes to get their blood pressure medication, they also can learn about their health literacy. They also can attend a Zumba class or a yoga class. They also can go to a cooking demonstration, and also go home with free fruits and vegetables from the produce gleaned from our fields in Ventura County. So they get organic raspberries because there happens to be a surplus one week. It's quite amazing. It's really cool. So with that, we hope to fill gaps by making it a holistic, comprehensive approach that makes it really easy to, the right choice becomes the easy choice. And so both in the environment and the community where patients live, as well as when they participate at our location, it's just easy, it's free, and all they have to do is give their time.
Esperanza or Carla?
Another gap that we're also identified is, like I previously mentioned, educating them in their health. So when they go and have their first lab results, it's a one-on-one conversation. We're reviewing their results. We're explaining what does high cholesterol mean, what does good cholesterol mean. And then that copy is given to them. They keep it in a brochure that we give them with the Corazones Sanos program. And the next 6 months, when we send them again, there's a comparison. Did you improve? And they get so excited when they see that their cholesterol went down, where their triglycerides went down. So it's filling that gap and helping them understand, I get it. I know why I need to stay healthy.
Dr. Gardner or Rich?
Rich?
Well, I think you hit the nail on the head when you said holistic, supportive environment. I think when we're reviewing the applications that come in, we're looking at the four corners of the application, and we think that these programs on the merits will move the needle. But I think that the programs that show results and the programs that are most enduring are the ones that have a holistic approach above and beyond that specific program. We hear all the time that you don't know what comes first, the cardiovascular disease, was it the depression, was it the alcohol and drug addiction perhaps? And so, you know, when we come into a place like YMCA here, the church we're at yesterday, we find that people may have come in for our program, but while they were there, they saw that there was a class on financial literacy or literacy, or had an opportunity to get, you know, pastoral care or whatever it may be. We can move the needle on cardiovascular disease, but we can't pretend that there probably aren't 10 other things going on at the same time. And so I think these programs, whichever avenue got people into this building, you know, there's a good chance that they're going to have a lot of different symptoms or issues addressed. And that's what I think makes them enduring and really powerful.
And I think there's one other point I'd just make, and that is it's sort of characterized in the name of the program, Connections for Cardiovascular Health. And you guys are making connections, so you obviously, in both programs. I particularly acknowledge the YMCA program with Northridge Dignity. I mean, that is a connection that you had to make. That you had to sort of get together for your community to make that connection and to get the sort of traditional medical support and the community engagement, community work that comes out of the YMCA. So the connections are so important, and the scope of the issues are so important that the community and the families are encountering that really does, we really like the way we've named this program of Connections for Cardiovascular Health.
Thank you, everyone. Let's move on to innovative approaches for cardiovascular health. Let's discuss the innovative approaches you use to help fight cardiovascular disease in the Los Angeles area. Both of your programs use culturally sensitive activities to reach Latinos. Can you explain a little how this approach will lead to improved health outcomes? Anyone can jump in right away.
So for Westminster Free Clinic, we have a one-stop shop where they come in to get their blood pressure medication. At the same time, we could be having a health education class in their language, very interactive with them. We also have a cooking demonstration classes, and at the same time we have free veggies that they could take home and use because they just went to a cooking class that showed them how to cook Brussels sprouts, which is something that in the Latino communities we don't even know what they are. We just learn from them, right? And we also provide free healthy exercise, playing cumbias, Zumba music that again they identify with and they're wanting to move with that.
I think for the YMCA here, this YMCA is really the center for community life in the Mid-San Fernando community. It's really their place where people come to celebrate. And going back to Zumba is how we celebrate at Mid Valley. You'll hear from Danny Ramos there in the back in a little bit. He's our Healthy Lifestyles Director, but we're taking a program and our exercise piece is going to be something like a Zumba because we want to make exercising fun and we want to make being healthy fun. And when we have Zumba, it's a party and everybody loves it. And we have so many success stories at our YMCA where a program like Zumba has improved the lives of so many just by making exercise exciting and fun. So that's just one of the ways that we're doing it with our program.
So I mentioned earlier, I thought that the engagement of the teens at Westminster was really unique and innovative, and I wonder if Carla might like to tell us a little bit about your involvement. And
I love volunteering. It's been a big part of who I am as a person. This is my 3rd year volunteering, so I miss every Wednesday. That's what I do. So I think for me, it's a big part, and it's just I love volunteering with the same people because I identify as bilingual, as a bicultural. I get my parents more. I know why something is something, and I think it's just a great way. I was learning a lot, of course. Every lesson, I grew up volunteering at the clinic. So being in part of Corazones Sanos, it's made a bigger impact. Knowing what's healthy, how to eat healthier, it's just a big impact it has made.
Another thing that's innovative that we try to do is that we try to, so we have, it's the medical, the physical, the social, emotional, and the environmental piece all together. So what we offer always keeps all those 4 components in mind. And I think that's really important for any program that's going to be effective. I think you kind of mentioned that earlier, that it's holistic. That's how we see it as holistic. So it's looking at all factors. And so our clinic offers all those pieces. So maybe they weren't so motivated to change their eating, but when SB meets with them and they have a high cholesterol, she's able to motivate them to maybe try and see if they can make a difference. And then when they see that difference, then they start telling their friends, and then their friends start coming, and they tell their families, and so they become educators of their community. But it starts somewhere, and often, even I think for all, it's human nature. When we have a problem is when we're most motivated to start doing something about it. So maybe for the parent generation, we get them because their blood pressure's high. But then in the process, they're changing their children's lives, they're changing the lives of their community, and we do provide a whole the supports around them. One of the biggest, in our evaluations, one of the biggest things we've learned from our patients is that the clinic makes them feel safe and makes them feel cared about. Before, when they had diabetes or high blood pressure, they just gave up, they thought they were dying, they were really depressed. But now they feel like there's a way they can actually do something about it and be successful, and that people care whether they do something about it, and they have a lot of supports in place, so it's not costly, it's not prohibitive for them to exercise and eat right and do the right things and learn. So I think that's really important in an innovative approach. And then another thing is the one-on-one, the health literacy, really understanding what's really going on for their bodies, because often there's a lot of, I know the teens do that too. They have a newsletter they've created, and they give out, and they talk about what all the myths around food and eating that they know they've heard from their parents. Yeah. And then Carla and the others put together this newsletter that debunks those myths. They put it in Spanish, and then they share it at the Latino markets and the 99-cent stores and all the places that they're going out to, as well as at the clinic. So there's a lot of pieces to making an innovative program.
And I would have to agree with that, and then also state, a lot of times mental health, depression, it's stigma. People don't want to talk about, oh, I'm depressed. Sometimes they're depressed and don't realize it. And what I like about the holistic approach, the exercise, the nutrition, is that incorporated in the program every week, Barbara does a stress reduction. It's either a meditation or a stress thing, to get people to calm down and to relax and talk about the importance of relaxation and taking time for ourselves, and stressing that it's not, it is our diets, but it's not just our diets. It's our lifestyles, it's our behaviors, it's our stress factors and how we deal with our stress factors. So eliminating that stress while you're doing nutrition education and exercise, you're not focusing on just, oh, here, let's help you to not be so depressed. It's addressing that we know that with chronic disease, depression occurs. But through stress reduction, through meditation, through any little thing to reduce stress, it's just a holistic approach that's innovative and added to value.
Yeah, I think we see that in a lot of the programs that do really well. A number of the things that were talked about. Some element of one-on-one coaching, however it shows up, we think is kind of a common denominator for programs that work. That shows up in lots of different ways. But we found in some communities, the notion of getting healthy for the sake of getting healthy can sometimes almost feel indulgent. It's not, eating kale is something people in Connecticut do. Like, I don't know. And so the one-on-one coaching is, you often find other reasons for why people to get healthy. So we had a woman in Illinois who was motivated by the fact that her daughter was going to get married the next year, and she wanted to look great in her dress for her wedding. And so, let's work with that, and let's build a program for her that had to do with that. But the notion of just eating more healthfully for the sake of it wasn't ever going to get her to move. And as I said, it wasn't even not only that attractive, but it felt a little bit like just indulgent. And so some element of one-on-one coaching for lots of different reasons, I think, is an important piece. And who that person is can be different. It could be a social worker. It could be a teenager. We've seen innovative programs in Arizona where policymakers are trying to figure out what to do with returning Army medics, highly trained medical personnel that are literally battle tested. But when they come back to the U.S., they often don't fit back into the health system. They don't have the right certification to be any paramedic or any different number of things. So different health systems are, particularly in areas where you've got high military retirees, are finding these medics can be really helpful in providing continuity of care and working them into the health system, maybe as they're working towards a certification for becoming a nurse or a paramedic or whatever, but using them with retired service personnel is having huge impact. So I think however you do it, some level of one-on-one coaching and providing high touch is hugely effective.
So what I hear our panelists saying is stop eating tacos dorados, right? Is that what it is? Okay, got it. Okay, so the next question is for Westminster. You have developed several innovative approaches in your program. You work with Latino high school students to deliver these type of programs, provide one-on-one coaching with a dietitian, and even partner with Latino markets to offer healthier foods. Why did you establish these specific approaches. And I want to hear from my high school student. Sorry about that, but I want to.
Yeah, she was number 4.
Oh, she's number 4. There we go. Yeah, I knew there was something there.
We have something more.
We are currently working with a lot of different community partners because we want to make it easier for our patients to make the right choice, which is not always so easy as we always say. But we are working with Latino markets because that's where most of our patients go shop. They don't go shop at Vaughn's. They go to the small local markets around where they live. So we created the DOT system, which is a way for the patients to know what are the healthier foods. We label the foods green and red dots. So the green is for diabetes and the red is for high heart disease, which in a way it's like reminding them those are the right foods, because we're always told, oh, eat your vegetables, but in that way it's amplifying the way that what they should eat. We also created the loyalty card, which is our markets also want something back. So that's a way of promoting them with our patients and our patients going to their stores. And it's the reward system, which is every time they go, they get when they buy the foods that are marked with the dots, they get a stamp. And after a certain amount, they get a discount. So that's a win-win for both of us. And we also have a poster outside that explains the DOT system for patients and for other community members. And it's especially for the literacy patients that can't read. So it's a simple way to explain what the DOT system is there for and why it's there. We have also worked with a local Latino printer, and he does all the printing. So our newsletters that go mostly every month, our flyers. Like right now, we're planning for a Zumbathon, so he is involved in everything like that. And our food share, they provide free and free fresh and fruits and vegetables every Wednesday. So that's some of the partnering we're working with.
So for time's sake, I'm going to speed it up a little. So we'll move on to the next question. How are you working with community partners to implement these approaches? Let's start with Chad.
Sure. I think we can all agree that it does take a village to really raise our kids, our families, and I think with probably both of these programs, we're not the experts in everything, you know. So the why we're great at health and fitness and running exercise programs and childcare, but we count on a partner like Dignity Health to provide that clinical expertise. So we cannot do it alone, and we rely on our partners to make it happen. Quick story, when I first arrived here in the Mid Valley, I've been here about a year and a half. Within my first week of being here, the phone was just going off the hook, and it was all the community partners just calling me and say, we do this together, and we do that together. And that's really what it takes to run these great programs, is everyone bringing their best foot forward to put the best program together.
We also work with different businesses, like the 99-cent store, which they let us go outside of their stores and educate people and take blood pressure and glucose of the patients, of course with the help of a medical assistant. A local Parks and Rec pays our weekly Zumba instructor. She teaches a class for Zumba that's free for all our patients, and it's right there at the clinic, so they don't have to drive somewhere else. And the Quest diagnostic, which comes to clinic every night. So for patients that don't have a ride to go to get their labs done, it's there for them if they can't do it during the day. And our food share.
I'm sorry. And then one other thing, when you talk about innovative approaches and who your partners are, I think a lot of times we've forgotten that the communities are partners, and to make them part of the process, not just being told what you should do and what you should eat and how you should exercise. But in this case for us, innovation is getting back to basic knowledge. The education is power, letting the community know that you're in this with us to become healthier, and simplifying it to, plant-based foods are still good. That, yes, all this amazing technology has made our lives so much easier. We don't have to wash our own dishes. We don't have to hang our clothes to dry. But that doesn't mean that we stop those movements, those exercises. We don't have to walk 2 blocks to the store because we can jump in our vehicles. To say, let's honor and appreciate all this technology, but let's get back to basics, and let's be part of our own health by walking and exercising and eating plant-based foods and doing the right things.
Okay, thank you. What impact have you seen from these approaches? Let's start with Westminster. Can you tell us about any initial results you have seen in the past year?
We have seen a big impact in that it has made for our patients, because they build their own families in the clinic. It's like their support group. They're all going through the same stuff. So they all get together to go to Zumba class and then go to the nutrition classes. So they're all working together for the same purpose. So when one person loses weight, it's like it's a victory because they're all living the same thing. They can still go shopping in the same stores, but now they're healthier options. Our patients are starting to take care of themselves, which is a result of decreasing of their stress level. When they feel great, they become happier and more confident in themselves.
How about the YMCA? What do you hope to accomplish through these approaches?
Definitely improving our community's health, definitely, but empowering them to do so themselves. We learn about the force field and how heredity is important and how our medical services are important. But we forget that our behaviors and our environment have a bigger impact. And so letting them understand that they have the power within themselves to make these changes with a little bit of education and support from all of us. And as you said, creating that holistic approach and having all of those community partners working with the local grocery stores and having them open their doors and creating programs like, I know Choose Health LA Kid, getting them to do kids programs to reward healthy purchases. So all of that is, we're hoping to improve lives, basically, and improve health, one person at a time.
Thank you. Dr. Gardner or Rich, did you want to add anything?
I think, once again, you're hitting all the notes. I think this notion of breaking the cycle through education. I think letting people know that this is not your destiny, that there's a different way to eat, there's a different way to exercise, a different way to lead your life. We support a community center. It's not a YMCA, but it's a community center in Greater Boston, where a woman stood up and said that she's the first adult member of her family that did not have to have an amputation as a result of diabetes. And in her family, getting diabetes and even having an amputation was a natural consequence of getting older. That's just what happened. And she took control of her health, got involved in a community center. Her children will not suffer that same fate. It breaks the cycle that I think all of these programs that are so powerful, they're intergenerational, breaking the habit, giving people new skills and educating them. That's what makes them really last and endure.
Okay, let's move on to our next discussion topic. Lessons learned, looking ahead, and best practices. So let's start with Westminster. What are some key lessons you have learned while implementing your program?
Key lessons is have a great communication between your team, strong communication, be consistent. When we have our participants come to clinic and it's the same person giving the health education, it's the same person giving out the lab results. Consistency makes them feel safe, makes them feel, oh, okay, I get to see you every Wednesday. I feel comfortable with you. Also, lesson learned, make sure when you're taking down demographic information from the patient, you get more than one phone number, because sometimes they're on a plan where if they're on a $30 plan, if it runs out, then there's no cell phone for maybe a week or so. So have your demographic information, addresses, make sure that you're updating that so that when you do need to remind them, hey, the 6 months is coming up, we want to see you again, that. And then make sure that what we're asking them to do, for example, lab draw, that they have choices. We could either have the Quest Diagnostic come to our clinic, and we could prepare them, hey, next week they're coming, make sure that you're fasting, or make Saturday appointments for them if possible, because they work, and it's very hard for them to get time off from their jobs.
YMCA, how does this partnership with AstraZeneca HealthCare Foundation challenge you to look at your work in a new light?
Well, I think first and foremost, making sure that all of our programs have an impact measurement at the end of the day, that we are really ensuring that all of our health and wellness programs have an end result. I think also with this program, we really had to cast our net even further in terms of potential partners. We found the San Fernando Community Health Center, Rita back there, that would actually come out and help us by doing the screenings at the beginning, end, and 3 months down the road after our program ends. So it's really, we're not just doing programs to do programs. We're offering things because we know we can make a long-lasting, impactful change in this area.
Westminster, what best practices would you share with other communities that are working to improve cardiovascular health?
I think I mentioned this earlier. Empower them to know, back to education, know their health. Okay, I had a participant that triglycerides were over 500, and the participant thought, well, I'm taking my medication, because in our culture, if I take medication, it's gonna take it away. And when you educate them and you say, well, it's medication, but it's also your diet, it's also your exercise, empowering them to know that.
And for the YMCA, what best practices do you hope to develop through this program?
With us, I think it's piggybacking on the LA County Department of Public Health's REAIM model, looking to make sure that we have the right reach. Are we reaching the right audience? And I would say through this program, check. Yes, I think we are. Are we being effectiveness? We're in week 3. We're just starting. Tomorrow will be week 3 of our first session, so we're the newbies. So far, I think we're being effective, but I think Barbara and Danny can speak more to that than I. Have we adopted the best model? And I think we have. It's new, so we're going to find that out, but I would say check on that. Our implementation, are we implementing it in a manner that's culturally and linguistically appropriate? And yes, we've got the right staffing, we got the right level of staffing. So I would say check. And then again, our maintenance, are we going to look at that long-term effect in that community? And by doing the baseline, the 8-week and the 3-month follow-up, I think we will know that. So I can't check that maintenance yet because we're not there yet, but I'm really confident in the team that we have together and the community, because I see a community that wants to change. They want to be healthy. You know, this word personal responsibility sort of came out with the Affordable Care Act. We didn't hear a lot about that, but it's more than just personal responsibility. It's having community and stores and all of the support to make personal responsibility a little bit easier, because your economic, your education attainment level, all of that has a lot to do with decisions. And, you know, we have to help them along the way.
In a minute, did anyone want to add from our panel?
Well, let me just add on to what was just said, and that is the importance of sustainability of these programs. And obviously, the AstraZeneca HealthCare Foundation is providing startup funding for these programs, and we're choosing what we believe to be the most innovative and effective ways, and we have great evidence. I mean, we're so gratified to see the great work that's being done here with these two organizations and others that we funded. But and obviously we've forced or pushed our awardees to provide some evidence of outcomes and improvements. But sustainability really is what we hope to leave, the message we leave with the communities, that these are great programs and they may require some adaptation along the way, but sustaining them is what's going to really make a difference for the community. And we believe that it will happen, and we believe that the 50,000 people that have been reached by the foundation grants are going to be magnified and sustained over the years.
Thank you. And for our last topic, let's talk about AstraZeneca HealthCare Foundation support. How will this grant funding from the AstraZeneca HealthCare Foundation impact your community? Let's start with Westminster.
How will it impact the community? I think that we're seeing in the families when the parents are educated in what is a healthy living, they are also providing healthy meals for their children. They are able to go to work Monday through Friday because they're healthy. So it's impacting, in general, the entire community.
They also so we train teens, and then they teach others, and our patients become part of our education team as well. So we share this information with them, and then they share it with their neighbors and their friends, and so that's a really important impact that's going to be long-term. I think that the teens are really, really a crucial part, because then hopefully they're seeing their power in the community, and they're going on then to go to college and become leaders, our future leaders. That's really important.
YMCA?
Yeah, I think with this program, it really is allowing us to go out into the community, and kind of what Rich said, everyone shows up to these programs at a different place in their life. They may not be coming to the Y to be healthy and fit, but this program takes really out into the community. We're going to go to some of the local LAUSD schools. We're going to offer the program at the hospital. But after the program's over, we are hopefully bringing them back to the YMCA and giving them 3 months of wellness coaches, follow-ups. After they've complete the program, we'll check in on them 6 months later. So really, we're hopeful that this is a plan for long-term health and a commitment to helping their family be healthy.
Joni?
I absolutely think funding from AstraZeneca, the foundation, it just shows AstraZeneca Pharma, their business is drugs and things like that. But it just shows that everyone wants to work together and have a healthier community. It's not about waiting till after the fact, till they have coronary heart disease. It's keeping them from getting it to begin with. So I think what this funding does, it says is that we want to partner with you to keep our communities healthier. And I think with all of the collaborations that you have and bringing the teens in, I just love that idea. It's protecting our future. We know that coronary heart disease has been the leading cause of death for a long, long time. Tommy Thompson once did a report that said that every 60 seconds someone dies from coronary heart disease. That means that while we've been here, we've lost about 120 people due to coronary heart disease. And so I think AstraZeneca funding with community partners actually helps to maybe reduce that number sometime down the road. These changes don't happen immediately, but hopefully soon.
You're helping us engage with the community in a way that can last and be sustainable.
And for our last question of the day today, looking forward, how will you learn from your partnership with AstraZeneca HealthCare Foundation in order to grow and sustain your program? I think the Y kind of mentioned it, but I'll open it up to the panel.
Some of the things that we believe that are really good are maintain a train-the-trainer model so the community can keep teaching each other, and to create social and emotional supports that focus on whole health. So we have yoga at our clinic, we have mental health counseling for individuals who need that. We have many different ways that we create a social environment that supports people where they're at. Measured outcomes that we have from AstraZeneca Foundation are really going to help us move forward because we have really great data. We're showing we're having a big impact. We've really moved people's health to a better place. So we have 4 patients who are off meds altogether who had heart disease. That's the important thing, right, to continue.
Congratulations. So this concludes the panel discussion. I want to thank the panel for giving us the information and the great work they're doing in their communities. I also want to thank our special guests here that came to listen and our elected official offices. Without all their supports, this also wouldn't be able to happen. So, and I also thank you for allowing me to be the moderator for today. So now back to Rich Buckley.
Yeah, well, thank you. It's no coincidence that when I think in my mind of what are the elements of what all the best programs do, that you all just sort of said them organically. One-on-one coaching, education that leads to empowerment, programs that are sustainable and sticky and infectious. And I love the intra-generational aspects of it too, and we've seen it go both ways. But whether it's kids that are pulling their families along and then their children after that, but we've also seen programs with retirees. We had a woman that lost a lot of weight in one of our programs in kickboxing, and she took her first kickboxing class when she was 67. And so it goes both ways. But there's no doubt, I think Dr. Gardner and I feel really confident listening to this conversation that your programs are indeed among the best of the best and are going to drive real change within the time horizons of the grant and then long beyond that. So let me thank you. And on behalf of Dr. Gardner and I and the entire foundation board and all my colleagues at AstraZeneca, I just say that we are really privileged and humbled to be affiliated with this community and with your organizations. It makes us really inspired and proud. So thank you very, very much.